Okay, so I'm going to be performing an IM administration today. So the first thing that I would do is check doctor's orders against the MAR. I have Haldol 4 milligrams IM every 6 hours PRN for severe agitation. And then I have 5 milligrams per mil of Haldol on hand. So when I did the dosage calculation, we'll be giving 0.8 mils of Haldol today. So after I've done that, I'm going to identify patients. So I'll have the patient state their name and date of birth. I'll go ahead and wash my hands, don my clean gloves, and at this point, I'll go ahead and perform a focused assessment pertaining to this medication. So this patient is receiving Haldol. I'll just want to ask the patient if they received any Haldol recently. The last injection site, they got some in their left deltoid that last time, so we'll give it in their right deltoid. You'd also want to assess the skin for any redness or swelling or anything like that. And a few other IM sites that you can give medication in. There's deltoid IM, ventral gluteal, dorsal gluteal, vastus lateralis. So after I've done that, I'll have the medication pulled up here, and then I want to go ahead and just check it again against the MAR, making sure it's the correct medication amount. Then I'll check the expiration date, making sure that it hasn't expired. I'll grab an alcohol prep pad, cleanse the top of the vial. Have my needle here. Today we're going to be using a 22 gauge, 1.5 inch needle to be drawing up and administering the medication today. So we're giving 0.8 mils. So I'm going to pull back 0.8 mils of air first. Okay. Going to go ahead and inject that into the vial, inject the air. Then I will pull up 0.8 mils of Haldol. Trying best as possible to make sure I don't have any air bubbles. Okay. Okay, so I have 0.8 mils of Haldol. Recap the needle, and at this point, I'm gonna go ahead and twist that top off, put that into the sharps container, and I'll go ahead and screw on another cap. And this is the same gauge needle, 22 inch gauge. And okay, if I'm preparing all this medication before I go into the patient's room, I'll go ahead and initial the syringe, and then I will check this with another nurse. Okay, so once I enter the room, I'll check the MAR again, making sure it's the correct medication. Then I'll explain the procedure to the patient, basically letting them know I'm getting ready to give them 0.8 mils of Haldol in their right deltoid. So I will grab another alcohol prep pad. This is the patient's deltoid. So I'm gonna go ahead and just cleanse the skin or wipe down with the alcohol prep pad. With my needle, just kind of pull the skin tightly back. I'm gonna insert at a 90-degree angle. Insert. And I'm going to aspirate. And I'm going to go ahead and slowly inject this medication. And just leave it there for a second. Remove the needle. I would place in the sharps container. Grab an alcohol prep pad, or preferably I'm going to use a cotton ball. Just hold tightly on that right deltoid injection site. And then I will go ahead and remove my gloves, wash my hands, and then I would document the procedure, the injection site, which I gave, which is the right deltoid, how the patient tolerated the medication, if there was any kind of redness or swelling on the patient's skin or around the injection site.